while some people are still trickling in. Welcome to our Autumn Quarter Lightning Talks, one of our favorite CSDE events. And after a quarter of seminar style talks, it's really, really nice to see people's faces and names and sort of feel like we're all coming together, even if it's not in Allen Library. Those of you who don't know me, I'm Jessica Godwin. I'm the interim training director at CSDE, and we have an exciting set of posters from 4 of our trainees today. For those of you who have been to lightning talks before, you know how fun and exciting this event is and how great the research and the quality of posters tends to be. For those of you who don't know, you're in for a treat, and in past years, even some CSDE posters have gone on to win Best Poster at PAA, or their further derivatives from the feedback they get here. And so I'm gonna just go through a little bit of how today is gonna work, and then I'm gonna hand it off to our student organizer. So first of all, we have 4 talks today, and they'll be quick talks followed by posters where you can go talk to the presenters about their work and see it in a little bit more detail. We've had a great panel of faculty who have already voted on the posters and provided feedback, and we're really grateful for their time. I want to go ahead and thank Jerry Herding, Marika Clay-Witter, Peter Catron, and Laura Dwyer Lindgren, wonderful affiliates for your service and for giving our trainees great feedback and support. So while we do have a panel, the exciting thing, in my opinion, for the audience members, aside from the great research at Lightning Talks, is that y'all get to vote too. So the panel's votes do count a bit more than the audience. They count 60%. But in a moment, we will put a link in the chat so that all of you can vote on what poster you think is the best later on in the event. And we're really grateful you're all here. So without further ado, I'm going to go ahead and hand this off to our graduate trainee, Courtney Allen, who has done a ton of work all quarter. She's a doctoral student in sociology, to organize this event, to get the presenters together. Yeah, let's all give it up for Courtney.
Hi, thanks, Jessica. So today we have 4 presenters. Each presenter will have about 3 to 4 minutes to talk about their work through a series of slides in their poster. And after which we'll get to go into breakout rooms. We'll have about 15 to 20 minutes. You'll get to join breakout rooms at your own leisure. And during the presentations and during the breakout rooms, as Jessica said, feel free to fill out that survey. You can, open the link now. It'll be put in the chat shortly. You can open the link, fill it out as presenters are working, since you can give them personal feedback, which is always really great to have as a student, any sort of feedback, and you can vote there. Without further ado, we are going to go to our first presenter, Ellie Terry, a doctoral student at the Evans School of Public Policy and Governance.
Thank you, Courtney. So currently, about 13% of American households with children are resource deprived. That is, they do not have enough financial resources to meet a basic set of expenses. Now, this figure is not the poverty threshold. Instead, it is a measure that takes into account both the local cost of living and the receipt of federal and state public assistance programs and tax credits. Now, Black and Brown households with children are even more likely to experience resource deprivation. About 1 in 5 do not have enough financial resources. This disparity creates an unequal environment for the children growing up, contributing to racial inequality outcomes later in life. One potential solution currently being piloted at over 50 locations across the United States, including 2 in Washington, is guaranteed income. Now, the idea of guaranteed income is to distribute some set amount of money to most or all American households. Unlike current public assistance programs, GI can be spent unconditionally and is not lost if income or assets are to increase. One downside of guaranteed income is that its value is reduced due to the interaction with the social safety net. For some social safety net programs, including the commonly accessed SNAP, GI is going to be counted as income. And thus GI essentially replaces some value of the public assistance the family currently receives, instead of being added onto the top. Now, if you look at the colorful chart on this slide, it demonstrates the effect of a $12,000 a year guaranteed income on the receipt of public assistance. A one adult and one child household living at 100% at the federal poverty level in Tacoma, Washington, receiving a $12,000 a year guaranteed income would net about $8,000 in financial benefit after taking into account the loss of public assistance. So in this project, I performed the calculations shown in the chart for every household in the US to understand how GI can close the resource gap between racial groups. Next slide, please. Specifically, I'm going to conduct a simulation exercise where I give all households in the American Community Survey $1,000 per month. Now, before giving everyone in the survey guaranteed income, I first add up income and public assistance receipt, taxes and tax credits, and subtract off the local cost of living to determine the share of the household that are currently resource deprived. Then I give everyone $1,000 a month and recalculate resource deprivation to see how it changes. So overall, I find that the share of households with children living with resource shortages shrinks from 13% to 1%, and the disparities by race by this measure are essentially eliminated. Thank you for your time. And please come to my poster session afterwards to learn more about GI and how I'm helping GI pilots across the country understand the interaction of GI with public assistance.
Thank you very much, Ellie. Our next presenter will be Elizabeth Nova, a doctoral student in the sociology department.
Thank you. Hello, everyone. My name is Elizabeth Nova. I'm a graduate student in the Department of Sociology, and today I'm going to talk briefly about our project. So talking about the jab, medical professionals' expressions of vaccine hesitancy online. Next slide, please. So the question that is really driving this research is, who is more vaccine hesitant, doctors or nurses? So one of the most influential authorities on public health in the United States is medical professionals, doctors and nurses, and they have many opportunities to encourage vaccinations. And so with the widespread use of social media, particularly Twitter, for information sharing and seeking, offers the average doctor and nurse a public platform in which they can share their views on vaccines, vaccinations directly with thousands of individuals across the globe. So in this study, we specifically are interested in doctors and nurses who are verifiable and are active on Twitter to express their statements on vaccines and vaccinations. Next slide, please. And so to identify and examine the vaccine discourse of medical professionals online, we manually verified the medical credentials of 196 doctors and 213 nurses on Twitter using the CIP COVID-19 database, and then labeled their stance on vaccine as pro, neutral, or anti. This is based on the content of their tweets. And so as you can see here on the slide, for doctors, we look for official websites associated with hospitals or primary care facilities. And for nurses, we employ the National Council of State Boards of Nursing. This is a not-for-profit organization created a database of licensed nurses across the nation. Next slide, please. And so for our early results and future directions. So our preliminary results suggest that nurses are almost 3 times more likely to be vaccine hesitant compared to doctors. And further, we can see that both doctors and nurses increased engagement on vaccine-related issues as COVID-19 takes off and as vaccines have become more available. And so for our ongoing and future work, we do plan to increase our sample size to 1,000 doctors and nurses. We would like to analyze tweet metadata, for example, the likes, the retweets of these individuals. And we do want to compare an unverified sample with a verified sample. and then do some type of content analysis between important time points to better understand the characteristics of these medical professionals on social media and their impact on vaccine uptake in the United States. And thank you. That'll be it.
Wonderful, very interesting. Our next presenter will be Asia Sutton, who's a doctoral candidate in the geography department.
Thank you, Courtney. It's been established in international contexts that variability in risk perception is linked to people's socio-political environments and the trust they place in governments to make just and fair decisions for their well-being. These two factors have also been linked with mask-wearing directive adherence. In the US, various levels of government have directed the public to wear masks during the COVID-19 pandemic. I'm interested in the socio-political trends and systems relating to trust of governance and mask wearing. A preliminary step in this work is considering a related basic question: what is the relationship between trust in government and mask wearing in the United States? Data. This work is based on a nationally representative longitudinal survey at the zip code level of an initial 1,400 respondents taken over 3 waves: September 2020, December 2020, and June 2021. This survey focused on COVID-19 related pro and antisocial behaviors, including mask wearing and trust of government, as well as standard demographics. Figure 1 shows the geographic distribution of the sample population by county, considering race ethnicity, to give you some idea. Methods. To analyze these data, I built a mixed effects logistic model that considered mask wearing as an outcome. The predictors for this model were trust at the local, state, and federal government levels, age, urbanicity, race ethnicity, racial composition in the geographic unit, employment status, time or wave, and zip code, which I crosswalked to Census Bureau ZCPA. So what have I found so far? Slide, please. From left to right, we see the modeled predicted probabilities of mask wearing given level of governance for waves 1, 2, and 3. Local government is in green, state is blue, and federal is purple. Generally, we see that mask wearing was predicted to be more probable in waves 1 and 2 and less in 3. We see that local trusts in waves 1 and 2 was associated with a higher probability of mask wearing, indicated by the large green arrows, and state trust had a higher probability in wave 2, indicated by the small blue arrows. In wave 3, however, local and state trust have limited effect. For the federal level, looking at the small purple arrow on the left, trust in waves 1 and 2 was associated with a lower probability of mask wearing, whereas in wave 3, it was associated with a higher probability. The inverse is apparent also, where federal distrust in waves 1 and 2 was associated with a higher probability of mask wearing, and in wave 3, it was associated with a lower probability. As I have illustrated along this black line below the graphs, given waves 1 and 2 were collected during the previous Republican administration, and wave 3 was collected during the current Democrat administration, I suggest these trends are politically partisan. We see that there is some support for trust of governance in some way predicting or affecting mask wearing behaviors, but this requires more research. So these are my findings so far. However, the model I'm using does not account for geography adequately, and my survey sample is quite small. So my next steps involve shifting to a Bayesian framework and incorporating geocoded data from the American National Election Survey, the American Community Survey, and the COVID-19 Trends and Impacts Survey. Most excitingly, I am exploring combining multi-level regression with post-stratification with spatial statistical methods. Thank you for listening today, and I look forward to discussing this with you further.
Thank you, Asia. And before we go on to our last presenter, just a reminder to open the survey link that's in the chat where you can vote for posters, and you can also give individual feedback to presenters. And last but not least, we have Elizabeth Pelletier, a doctoral candidate at the Evans School of Public Policy and Governance.
Hi everyone, I'm Lizzie Pelletier, and I'll be talking about a project that uses Seattle Police Department data to look at racial disparities in police use of force in Seattle. So racial disparities in exposure to police violence are really well documented in the US. The lifetime risk of being killed by police is more than 3 times as high for Black men compared to white men. But a lot of people who've studied use of force have come up against a data limitation, where they're only able to study situations where force was used. And these analyses can't really answer what affects the likelihood of using force versus not using force, because they don't have data on times when force was not used. And I'm able to overcome this problem because I use data from the Seattle Police Department that merges information on police calls for service to use of force incidents. So calls for service are my unit of analysis, and they include 911 calls and police-initiated investigations, basically any incident where police encounter people in the city. And with this data, I'm able to answer what factors are associated with the likelihood that SPD uses force in response to a given call for service. So on the next slide, this is a map of Seattle police beats showing how the rate of force incidents as a share of the number of calls for service in the beat in 2019 compared to the citywide average. And so the darker blue beats had lower than average rate of force use relative to calls, and the darker brown beats had higher than average rate of force use relative to the number of calls in that beat. And then when on the next slide, we visually compare this to a map showing the share of the population that's Black in each beat, you can see pretty striking similarities in terms of where in the city SPD is more likely to use force relative to the number of calls, and beats where a larger share of the population is Black. So building on this on the next slide, I fit a multivariate logistic regression model to test what factors are associated with the probability that SPD will use force while responding to a given incident, controlling for call priority level, time of day, type of call, median income in the neighborhood. And I find that the likelihood of use of force in response to a call is significantly higher when a higher percent of the population is Black in the neighborhood where the call occurred. So this graph shows that for a call with a given priority level, for example, the green line, a high priority call, likelihood of force use rises with the share of the population that's Black in a given beat. And let me give you a sort of more concrete example of this. So if you think about comparing a high priority 911 call occurring in the South Beacon Hill, New Holly neighborhood of Seattle, where the population is 28% Black, compared to the same type of call occurring in the North Ballard, Loyal Heights area, where the population is 0.3% Black, my model predicts that Seattle police would be 68% more likely to use force responding to this 911 call in South Beacon Hill compared to a similar 911 call in North Ballard. And I look forward to discussing more in the poster session.
Wonderful. Thank you to all the presenters. We're exactly on time. Really interesting research. We are opening breakout rooms now. You can join. Feel free to join. There should be 4 rooms. Maybe give us about a minute for those to show up. You can join the rooms, ask questions to the presenters, see the posters closely, and then remember to keep filling out the survey. And we'll call everyone back here in between 1:10 and 1:15. You should be able to click on the Breakout Rooms logo at the bottom of the Zoom call now, and you can join the rooms.
Courtney, I don't know if it's just me, but I am not seeing that button.
We weren't.
I'm not either.
That.
Sorry, that's my bad. Hold on.
Okay. Hang tight.
I'm sorry about this. We did a thorough test yesterday multiple times and I've somehow messed it up, of course, when it's time to go live.
In the minute we need to sort this out, go ahead and open the link if you haven't to write back some of those notes to some of the presenters while those thoughts are fresh in your head. All of those notes are really helpful, even if they're small comments on figures or how the presentation was. I know our students will be really thankful to hear from you.
Okay, did that work?
Yeah.
Great. Sorry about that, everyone. Thanks for your patience.
Hi, Taehoon, can you hear me?
Hi. Yes.
Okay, awesome. Just want to make sure you can hear me. We'll be messaging you who the winner is, but I will introduce you first. So,
Okay. Thank you so much.
can you say your name, your full name for me, so I know I'm saying it correctly?
Yeah. Taehoon.
Taehoon
Yeah.
Kwan.
Great. Yeah.
Taehoon Kwan. Okay. Thank you.
Thank you.
Thanks, Jessica, for figuring all of that out.
No problem. I had not selected the let participants choose their own, but then I had to close them, which took 60 seconds. So I was just like waiting.
No worries. I'm glad we smoothed it out. I was wondering, I was like, wow, nobody's chosen a room yet. Like all 40 people were just sitting there. I am going to pop into each of the rooms and put the link in. I'm not sure who sees them as the link comes and goes, but at least it will be there for someone to share. So, oh, you're on mute.
You said sounds good. I'll stay here in case people need things.
Okay. The link is everywhere. Are there votes coming in, or is there anything I can do to help on that end?
No, it's pretty simple.
Okay, great.
They are coming in. I'm just keep updating.
We have roughly, was it 40?
Yeah. And I guess, and some of them are panelists, so I don't know if they would fill one out or not. But yeah, I think we should be
Like
looking
maybe around 30.
Yeah.
Yeah, okay, that's what I was thinking. Yeah. Jessica, do you think I should still send out the broadcast message at 1:10 or sooner?
I think 1:10 would be good. People still seem to be moving around a bit, so.
Okay, great. I broadcast the message. I don't think we can see it in here though.
I got it.
I did. Okay, great. That's fine that I don't get to see it.
Yeah, that's weird. I keep thinking too, if anyone is actually watching this on YouTube, what a like, yeah, at some point, surely they've logged off by now.
It's true. I guess the recording, people have to really fast forward through this part. If I give a 1-minute warning at 1:14, will we need some time to, sorry, you're muted. You're muted, sorry.
No, the red cap creates like a bar chart. So I'm not actually like hand counting.
Great. We'll just give everyone a minute to rejoin our larger room here.
This is really cool, by the way. Just wanted to commend all of you for organizing this. It's always really neat at the end of the quarter to watch.
Thanks.
Thanks.
It's definitely been hard and online, but actually the Zoom update, Zoom did most of the good things for us this go round, because now we all have the ability to travel between rooms without, any of you who attended some of our first remote ones know that there was a lot of, a lot of tricks used to make this work.
Oh, sorry, go ahead, Tiago.
No, you go. I was just going to say, when I was in the beginning of the quarter, I was trying to Zoom and use my speaker notes, but I couldn't figure out how to do presentation view. So I had two laptops. One was the actual Zooming with my students, and the other one was where my notes were. And it was pretty hysterical to think about how just ridiculously slow I am at adapting new tech.
No, it's always difficult. And I even thank you to all the presenters today for your great work. But even technically speaking, I mean, I think we all have to do a lot of practice in figuring out slides. And so this is always a little bit of a challenge to put on virtual events. So thank you to everyone for your flexibility and for showing up and engaging. This is really fun and productive for everyone, really, to see research, to do research, and to get to talk about it. So I'm actually going to introduce, we have a guest of honor today. Tae-Hoon Kwan is our best poster winner from spring quarter at the CSD Lightning Talks, and he will be announcing our winner.
Thank Courtney and Jessica for having me back. It's such a pleasure to be here to enjoy wonderful research that could change the world in the future from the young talented scholars. And also, I'm sorry that all these presenters cannot win. So the best poster award goes to Elizabeth Pelletier. Congratulations.
Thank you.
So thank you, everyone. Thank you, Elizabeth. It was a great poster, and we will be in touch for your wonderful award, one of which will come electronically, and then whenever you're comfortable, come by CSD and you'll get your coveted mug. I want to thank everyone again for coming, and if we could all either championship belt. We should have a Lightning Talks winner playoff sometime. If we could all either, however you like to do it, unmute or use your reactions, but can we thank all of our wonderful trainee presenters for coming here, presenting great work, being great representatives of CSDE. We're always so proud of you and the work that you do. And I want to huge thank you to Courtney. You did a great job organizing. This has just gone so smoothly. And another big thank you to our affiliate panel. Your time means a lot to us and to the students. I also want to thank Gianna Conataro, our program coordinator, and Grace Falcon, our information specialist, for helping us with the details and the organization. And the rest of the CSD admin team. We will be having our another Lightning Talk session next quarter in winter. So from what I understand, we'll be moving to a hybrid CSDE 501 format, so people can attend in person at the Hans Rosling Center or online, whatever is your comfort level. So I'm imagining that the Lightning Talks format will also evolve. So be on the lookout next quarter for students for calls to submit and present your research, and others for how this event will play out in winter quarter. Good luck with your finals and the end of the quarter, and everyone enjoy your break.